from Nairobi?
Yes, Samuel, I can hear you.
Very nice.
Good afternoon, good everybody.
Good afternoon. We are going to listen to you first, and you're going to speak to us on the role of evidence in identifying MSMEs and informing the design measures of the government response. In a nutshell, evidence from research to inform policy towards MSMEs. Dr. Okwi, you have the floor, and you have 6 minutes. Dr. Okwi, please.
Thank you, Samuel, and good afternoon from Nairobi. I'll go straight to the subject issue, that is the role of evidence in identifying SMEs and also how evidence can be used to inform policy. To kick off my discussion, basically, it's time we realize that governments ensure that policy is driven by evidence and reasoning. And we need this research that we generate to be translated into action. So evidence in this case, we are basically relying on data which is collected and analyzed, and this transforms into information. Once the information is applied to problems, then we get the evidence. Now, in the context of the micro, small, and medium enterprises, we know that COVID-19 has hit the sector hardest in terms of employment, in terms of income and other opportunities that most of these people were benefiting from the economy. So the worst affected groups, of course, are the vendors, the self-employed, the hawkers, the construction and transport sectors. However, we know that government, like other governments in the region, stepped in to support this and introduced a number of financial and safety measures. But in order to understand the impact of these measures, we need data, we need evidence. And in our case, we don't have a very comprehensive data set of the MSMEs in Uganda to support our policy formulation. Of course, we do realize that there are surveys that have been done in the past, but the challenge is that most of the micro and small enterprises are informal, and millions of these are located in various parts of the country. We have different players that have supported government in terms of generating this information. But the challenge is there are so many that employ or that are owner managed or self-employed and not registered. And these are more than 90% of the enterprises that we're talking about. So we could use trade unions, we could use retail associations, we could use local authorities to identify this. But we do not have these systems well entrenched, we don't have the structures. This poses a big problem. And I would like to say that currently the problem is not the money. We can see several governments have injected lots of money. The problem is we need the evidence to support direction of the targeted measures to these sectors. Now, COVID has presented a very interesting scenario, a very interesting window of opportunity for evidence to influence policy making, because several governments realize that they have been responding based on anecdotal evidence or observation. But to reach out to these groups, they need to be evidence, they need to be data. And yet we do realize that there is a complex relation between evidence and application to policy. So if government has to reach out to these groups, first of all, it has to figure out how it will ensure that the relief gets to the target. And yet we don't see an end in sight of the virus. We are only hoping that systems that are currently existing will be helpful in terms of identifying the MSMEs and then driving home the relief measures. This is really a very big challenge in our case. In East Africa, in Uganda especially, we are likely to see the bigger enterprises, medium enterprises benefiting more than the small enterprises. So the initiative that I see taken up by EPRC should be one of those that will be helping us to identify these MSMEs. First of all, we need the evidence to define the issues. What are the issues that these MSMEs are facing? We need the evidence to shape their agendas. We need the evidence to identify the options that government has presented and how to deliver them. And then we need to monitor and analyze the impact and outcomes. Now, all this cannot be done if the evidence that we have is not reliable, if it is not robust, if it is politically not neutral, if the evidence is not rigorous or substantive, if it is not timely. In this case, COVID needs a timely response. If it is not actionable. So the evidence must also be easy to understand. And we also need to look at what is the relationship of the evidence that we're generating in terms of development policy, development planning and processes. Are the communities involved? Often we see evidence from, policies designing top-down approach, and the implementers are the communities. But in this case, we need to get the communities involved. Are the structures functioning in terms of ensuring that there is uptake of this evidence? So this situation that we're facing in Uganda currently, the economic lockdown, is putting us into a very challenging environment. And I would like to note that having evidence or having evidence-based policy in place does not guarantee that the interventions will be implemented. And we all know this in our countries, that most of the policies have technically been designed based on evidence. The biggest challenge is the need to put in place deliberate measures to translate these policy actions into, the policy into actions. And again, just to crown it, I would like to say that without the evidence, it's going to be very difficult, very, very difficult for us to assess the impact of government support to this sector during the pandemic and beyond. So it's high time that we reflected on the need for evidence, and for the COVID challenge, this is going to be an example for other interventions that countries like Uganda and other developing countries are faced with, that we need to unearth this information, use this information to design the interventions, and then understand the implications in terms of the context before we can actually implement them. And finally, we need to do an impact assessment. We do not need to intervene alone. We need to do an impact assessment, and this is what will guide the future interventions. Thank you, Samuel.
Thank you, Dr. Paul Okwi, and for keeping time. You set us on a good pace. We are determined to keep time this evening and yet deliver the message. Thank you very much. We now want to, maybe before we go to